And we are happy to welcome to our studios today, Christy Turlington Burns, founder of Every Mother Counts and the director and producer of a new documentary called No Woman, No Cry. And beside her, Peter Singer from Grand Challenges Canada and the McLaughlin-Rotman Centre for Global Health. And we're delighted to welcome both of you to our studio today. Peter, you've been here before, but nice to meet you.
Thank you. Nice to meet you.
Thank you.
Let's start with a clip from your documentary off the top that will set the table for the discussion to come. Michael, if you would, roll tape.
The day my daughter was born was one of the greatest days of my life. But it also became the scariest. While I got the care I needed, too many women don't.
And so we are introduced to Grace, who's now 7 years old.
Yes, 7.5.
What happened when you gave birth to Grace?
Well, it was actually following delivering her. About an hour or so later, the fourth stage of birth did not happen naturally. And having had a perfect delivery and a really beautiful time with her in our first hour, I was completely taken aback to find out that it could turn so quickly, and that the birth center where I was within a hospital and being managed by a midwife and her nurses was suddenly, the obstetrician came in and took over and had to intervene with not a surgery, but an intervention to stop hemorrhaging. No. I didn't really know it was happening.
But you were hemorrhaging.
I was hemorrhaging. Yeah, there was definitely a lot of blood. I gathered that much. I had seen some deliveries before, and it was much more blood than I'd witnessed before. But the situation that happened and how quickly it happened was something that I was completely unprepared for. But it was managed very smoothly. I mean, my midwife and the obstetrician who backed her worked very closely together, and that was really where I attribute the management of what happened.
Was your life ever in danger?
You know, no, because I was in the right place with the right kind of care. But certainly in the few weeks afterwards, when I was trying to understand what had happened, I learned how that same incident, if you're not in those kinds of hands, without quality care like I had, my life would have been in danger.
And this obviously prompted interest on your part, and thus the documentary.
Yes, I mean, it wasn't an overnight idea to make the documentary. It took a little bit of time, but in the year or so after I delivered Grace, I started to travel with the humanitarian organization CARE. We traveled to Central America, where my mom is from, actually, while I was pregnant with my second child. And that's where I had this sort of real sense of, had I delivered here and had the complication I'd had with Grace, I likely would have died.
Peter, what types of complications happen that can lead to death?
Well, Steve, hemorrhage, bleeding, like what Christy just described, is a very common complication that can lead to death if you're in the wrong location, as Christy said. Other complications that can lead to death are infection and obstructed labor.
Now, we would, you know, the documentary obviously goes overseas, focuses on small villages in Africa, Tanzania. We don't expect those kinds of things to happen here. Do women still die in childbirth in, you know, shocking numbers in North America, in some of the most up-to-date medical facilities in the country?
Women still do die, sadly, in North America, in the United States, in Canada. In the United States, the rate is about 24 women for every 100,000 live births. In Canada, it's about 12 women who die for every 100,000 live births. But behind those numbers are enormous amounts of variability within Canada, within the United States. But I think the key statistic, Steve, to think about is that if you're a woman in pregnancy and childbirth, say in sub-Saharan Africa, you are more than 100 times as likely to die in pregnancy and childbirth than a woman in North America. And that's obviously just not right, and most of those deaths are preventable. So those are senseless, needless deaths, which is why I think you know, I'm so inspired by what Christy's doing.
Well, let's follow up on that then, Christy. I just mentioned you did go to Tanzania. There was quite a poignant story of a woman named Janet in the movie who's, I guess, more than 9 months pregnant, right? She's ready to go, and she has She has no money. She can't get to where she needs to go to have this child. What happened?
Yes, she was pregnant with her third child when we found her at the clinic where we were filming. And the day that we filmed her, we were filming several women. We were sort of focused on the midwife there and meeting all of the women who were coming in around that sort of 38 to 42 weeks of pregnancy. And Janet was sent home after about a day of observation. You know, it was a small clinic that had about 3 beds, and so after a certain amount of time, their guidelines say to send them home. Her home happened to be 5 miles on foot away from the clinic. And so had we not sort of been in her vicinity, she would likely not have walked back to the clinic at any point. And honestly, the clinic, given her complication, she was sort of a candidate for an obstructed labor, that she would not have been able to, they would not have been able to do anything for her at the clinic level. So she was referred to the hospital, but like you say, she didn't have the means to get there, not transport or the...
You got her there.
We got her there. We got her there.
Your film crew gave her the lift she needed.
We did. And
how did it all turn out?
She turned out fine. She delivered a healthy baby boy for AHA, and she says something very poignant in the film, which is that it was education that saved her life. It was the people who were able, she had access to at the hospital level, that were able to help her. And that's unfortunate. You know, the clinic level should be able to do more for her, and the transport piece of it. I mean, services are free in Tanzania, but without access to the services, a woman, you know, she may as well not have access to anything.
Christy, let me follow up with this, because I got to tell you, there was a moment in the movie where you're in Guatemala, and I think we heard a reference to something about the culture where it is considered noble or heroic for a woman to die in childbirth. Now, if that's the mindset you're dealing with down there, how do you make any progress?
I think that's the mindset when women don't have access to services. It's the mindset because in all of the stories that we covered internationally, almost every woman really was by herself. Even if she was married, her husband was certainly nowhere to be found.
Why not? Where are the men?
The men are, you know, they have a lack of opportunity as well in many of these countries. And so because of that, women, you know, do most of the work. Janet takes care of her family far more than her husband does, even in the best scenario. We were in Tanzania during a drought season, so it was particularly a difficult time for her and her family. But that idea of heroic, that comes into play when when you have no one else to rely on and you have nowhere else to go, you have to believe that there's a purpose. And when you lose a life, a child or the mother, that's just the way that it was supposed to be. But with a little bit of education and with people with certain skills, that doesn't have to be that way. And I think what we've found over several decades in North America has been that simple things like washing your hands and wearing rubber gloves, those have made a huge impact on the lives saved. And those are very simple interventions. So in lots of parts of the world, those interventions still aren't being widely used. And so that's one of the great things about this issue, because so many things can be changed just with simple hygiene.
Well, let's talk about some of that, Peter. There are 5 barriers to care when it comes to maternal mortality. Want to run through them?
Well, I think some of the key barriers are, firstly, the barrier to seek care. And so that relates to all sorts of things. I mean, we were talking about the role of gender a moment ago. In some places, women have to seek permission from their husbands to go when they're in labor to the hospital. I mean, these are the sorts of things that really do need to change. There are issues in transportation. You know, as Christy was saying in the case that she was talking about, there are issues once you get to the clinic. Is that clinic adequately staffed? Does it have the level of care needed for that complication? Do you need to go to a more sophisticated facility, for example, where you could have a cesarean section if you really do have obstructed labor? So, you know, the barriers are social, cultural, technical, medical, and those barriers, Steve, result in the death of 350,000 women a year. And most of those deaths, and I think this is the key point to bring out, are senseless, needless, don't need to occur. Preventable. There are solutions, and really at Grand Challenges Canada, we share Christy's commitment to this problem, and more importantly, commitment to finding the solutions.
I'm going to talk more about Grand Challenges in a second, but first of all, I want to talk to you as a filmmaker now. because you made what I think many people would consider to be a very controversial decision in this movie, obviously by focusing on, one of your stories focuses on safe access to therapeutic abortions. And you must know that by doing that, you are potentially alienating a segment of your viewing public and, potential support base who think abortion is murder and a crime and so on. So why include it?
Well, I'm a student of public health at Columbia University in New York City, and coming into this issue after having my experience and looking at the data, looking at the evidence-based information that I've studied, you couldn't deny looking at unsafe abortion. When you look at maternal mortality, it comes to 13% of all maternal deaths are caused by unsafe abortion. We know that is a preventable death. And so I have to sort of look at it and examine it. I knew it was not an easy story to tell, but I went to a country where there are wards full of women who are showing up at the hospital nearly dying, and they're allowed in and they're allowed to be saved because of the state that they come in, but there's nobody there trying to prevent them from getting into that situation in the first place. And that's something that I think needs to be illuminated.
Any producers or distributors associated with the movie who said, Christy, you'll have an easier ride if you don't include this story?
Well, I financed the film myself, and this is also my first film, so I also took some liberties in being able to make my decisions as I saw fit, and to really to observe. I mean, I was exploring the subject matter and trying to get beneath the surface of why are these women dying, why aren't we doing a better job, and in looking at that, I wanted to understand the barriers to care that they were facing, and I wanted to, when you see how few options so many women have, again, going back to what you mentioned before of this is heroic to die from, no, it's not. Every life is of equal value, and no woman should die from a preventable death. No woman, no girl, no woman.
Peter, let's talk about Grand Challenges Canada. First of all, what is it?
So it's an independent organization with its own board, chaired by Joseph Rotman, that's financed by federal foreign aid dollars. We launched about a year ago, and we invest in global health innovations.
Why this one?
This one, for exactly the reasons that we're talking about. This is maybe one of the most horrific, horrendous examples of needless deaths, of inequity, of carnage on women in the developing world and around the world that need not occur. These 350,000 deaths, most of them are needless, most of them are preventable, and Grand Challenges Canada is focused on solutions. It's, by the way, Canada's the first country to take a Grand Challenges approach to global health innovations in the world, and we're focused on solutions. Because
have you met Bill and Melinda Gates?
I have, and
did you get some money from them?
I have.
Okay, how much?
But
you want to tell us how much?
Sure. They funded a grant on the ethics of Grand Challenges in global health, which was a previous program that they had, and we had several $1 million in funding from them.
Several is such an innocuous number.
10?
10 million. 10's a number.
For ethics, which was actually very novel at the time, about 5 years ago. Because as we were talking about, a lot of these issues are culturally based, are gender-based. I recently had the opportunity to go to Delhi and do a TEDx talk with Melinda Gates. And that set of TEDx talks was on the issues of women and children. And I talked about innovations in women and children's health, and Melinda gave a beautiful talk on innovation in women and children's health. And she is so committed to this issue and so passionate about this issue, as is Christy. It's fantastic to see people who could be doing all sorts of other things with their time focusing on such a critical issue, drawing attention to it.
Let me follow up on that, Christy, because the question has to be asked, how adequately do you think governments or charities or non-governmental organizations around the world are putting their resources towards meeting this grand challenge?
Well, in the last few years since I set out to make the film, I started in 2008 and finished in 2010, and it was really critical at that time that I complete the film and have it be a useful tool while this global conversation was happening around funding last summer at the G8 here in Canada. I came up here, I screened portions of the film for parliamentarians. It was really important to take those conversations and ground them in human faces and human voices. These are statistics, and oftentimes in forums, because there's been this conversation around the loss of productivity, which is true and it's real, but it takes away the humanness of what this is. And so having that level of discussion, government leader level discussions, and having stories by women in their own voices is such a crucial and important thing to have at every table where those discussions are being had.
But those discussions are happening at tables where I think it's fair to say, especially if we're talking politics, men are almost always in the majority. And again, the question needs to be asked, this is something that happens to women.
Yes.
If it were happening to men, might there be more attention focused?
Absolutely. And what I've been trying to do in my messaging is really to talk about the families, the loss to families and societies and communities and nations, really, when this issue isn't addressed. I mean, maternal health is the key indicator of a health system in any country. So when there are maternal deaths happening, you know that there is a problem with the systems. And so we're trying to look at, I mean, that's really, truthfully, the way that we're going to make sustainable change is in fixing the systems. But in the meantime, babies are born every day, millions of them in every part of the world. And until we can really address those systemic changes, we still have to save the lives day to day. And so, reminding people that this affects all of us and bringing men into that conversation as much as possible and having more women in leadership positions.
And just to pick up on the point Christy was making, that G8 meeting she was talking about was hosted by Canada, Steve, as you know. And it was actually the Canadian Prime Minister, Stephen Harper,
Put maternal health at the center of it.
put maternal health at the center of it, launching the Muskoka Initiative, which then influenced the United Nations and other world leaders. And so as a Canadian, I'm proud that our country actually shined the spotlight on this terrible problem and is focusing resources on doing something about it.
Tell me this, though. You gave us some numbers earlier in our conversation here, which suggested that the United States had twice the maternal mortality rate that Canada had, which has got to, that's got to be news to almost everybody, because the U.S. tells us they got the best healthcare system in the world. So how's that possible?
Ours is most expensive.
Yeah, that's true too.
We lose 2 to 3 women a day in the U.S., and we're ranked 50th. That's the
in
latest
childbirth.
in childbirth. That's the latest UN data. So that is very shocking. We're behind countries like Saudi Arabia, Croatia. These are surprising to most people.
I don't want to
living
pick on
in
any
America.
state, but is it kind of in rural Alabama where this is happening?
Not entirely. New York has some of the highest numbers in the United States, believe it or not. But we have a large part of our state is a rural area, but South Bronx leading area. And this is also, certainly there are services and there are doctors in a lot of areas, but there is, only 1 in 5 women of reproductive age is insured in America, and we know that this is a huge predicament for the American health system. How many women fall through the cracks, and how many women are not cared for in their antenatal phase? I mean, prenatal care, it's the best way we can sort of identify complications that could arise: diabetes, obesity, hypertension. These are all causes in the United States.
Okay.
Steve, it's easy for Christy, easy for myself to throw around these numbers. I think the key message to your viewers is that 1 death of a woman in childbirth, in labor, is 1 death too many.
Agreed, but you won't get there tomorrow.
No.
It's going to take time. You presumably set targets and deadlines. So what have you set?
It will take time. So let's talk about some of the solutions that are being pursued. As I mentioned before, I'm really just amazed and inspired by what Christy's doing and her organization, Every Mother Counts, drawing attention to the problem. Grand Challenges Canada, working with some great partners, the Gates Foundation, USAID, the Development Agency in the United States, Government of Norway, World Bank, in early March launched something called Saving Lives at Birth. And this was a major challenge to the community of innovators right around the world to say, give us your best innovations to solve the problem of women and newborns dying in the 72 hours around the time of delivery, when sadly most of them die. We've gotten hundreds of proposals, and we'll be announcing the winners with our partners at the end of July. Melinda Gates, Hillary Clinton helped us launch the initiative. Christy helped us launch the initiative. And the key point here is what we're doing now ain't good enough. It's just not good enough. We need to do things differently and better. That's called innovation. Innovation saves lives, and that's why Grand Challenges Canada, with these partners, launched this initiative, Saving Lives at Birth.
So, Christy, if it's 350,000 deaths a year, where do you want to see it in 5 years? I know you want to see it at zero, but what's a reasonable achievement given what you're trying to do here?
Gosh, I don't know what would be. I've never even. I mean, there are the Millennium Development Goals, which their goals or the target goal is to reduce maternal mortality by 3/4 by 2015. That's likely not going to happen. There's been a few countries that have brought those numbers down, but we're not going to get them down where those goals are. So we'll need to reset those goals. But I think we can certainly make a better and more concerted effort towards bringing those down in all of the countries. There are, you know, of the 11 top countries with the highest burden of maternal mortality are happening in 66% of those deaths are happening in just 11 countries. So focusing on those with the highest burden is kind of an objective of mine personally. Many of them are in sub-Saharan Africa, but India and Bangladesh are also on that list, Afghanistan. So really trying to shine a light on what's working in those countries. Ethiopia's had some success bringing the numbers down, as has Bangladesh, and I'll be going there next month to check on those successes.
But your basic point about keeping commitments, keeping track, watching the numbers go down, making sure they go down is really important. So what happened, for example, after Canada's focus at the G8 on the Muskoka Initiative, and then the Secretary General picked it up in September with an initiative, then the World Health Organization created a Commission on Accountability for Women and Children's Health that is doing just that, Steve, what you're pushing on, which is accountability, keeping commitments. Canada is the co-chair. The Prime Minister of Canada and the leader of Tanzania are the co-chairs of that commission, Prime Minister Harper. And so your point about accountability is really important. We need to make sure that these senseless, needless deaths do stop. And again, very proud that Canada's having a key role in that. And again, just inspired and awed, Christy, by the work that you're doing. I'm really proud that we've been able to become friends over the past year, and my hat's off to you in terms of the fantastic work that you're doing.
Thank you.
And let's just finish up by coming full circle. Your health, you recovered completely?
I did. I lost some blood, but I didn't need a transfusion, which can often happen in my kind of complication. And just spent some time, you know, after I had my daughter, getting the right nutrients and iron and all of those things back into my system. I had a second child who's 5 now, and yeah, I'm perfectly healthy. Thank you.
Good stuff. Christy Turlington Burns, founder of Every Mother Counts, the director of No Woman, No Cry, and Peter Singer from Grand Challenges Canada. Good of you to join us at TVO tonight. Thanks so much.
Thank you.
Thank you, Steve.